Welcome back. Here with us on Urban Debate on Mirror Now. On Sunday, India began a new phase in its vaccination drive. Booster dose is now available for all above 18 years of age. Till today, 9,764 people have got booster shots in the age group of 18 to 59. Now, this phase of vaccination has begun at a time when states such as Delhi and Haryana have started witnessing a rise in their weekly COVID count. National capital Delhi and Haryana specifically. Meanwhile, another case of X series has been found in Gujarat. How dangerous is it? Is this behind a rise in COVID cases in some parts of the country? Let's find out from the vaccine panel chief, Dr. NK Arora, Chair COVID Subcommittee of National Technical Advisory Group on Immunisation. He's joining us live on the broadcast this evening. Dr. NK Arora, thank you very much for joining us here on Urban Debate on Mirror Now. Good to have you on the show this evening. Now, cases of X series of Omicron variant have been reported in Maharashtra and Gujarat. How dangerous is it? How concerned is the centre about this?
So we must first of all understand what is this XE. And Omicron as a virus has many subtypes, BA1, BA2, BA3. India has suffered from all these three, but in recent times, more than 3/4 of the virus isolates are BA2. In fact, this was the one which is labeled also a stealth virus. Now, this virus has a unique characteristics. It has many break points. And as a result, the virus breaks. And then if there is a mixed infection of BA1, BA2, they stick onto each other or join. So it is mix and joining of substrains of Omicron. So BA1 and BA2 can join and they can break at several points and they can stick on to each other, those pieces. And this has been given the name of X series. Now, XE is one of those, but there are 15, 16 similar variants, which is XL, S, J, M, N. So there are plenty of these X series viruses. And I would also recall back that during Delta, immediately after Delta, we had learned about Delta Plus. And we had AY series. Initially, there was a lot of concern and panic that what will happen. It is exactly the same situation that now with Omicron, this X series has come in and people are concerned what is going to happen because we faced the third wave very nicely and there was hardly any pressure on the health system. Deaths were not too many and the hospitalization also the pressure was not there. Now coming to the specific question of XC. Now XC was first told to us by BMC in Mumbai. And the problem with this XC series is, X series is that it requires 2 or 3 levels of confirmation. Then only you can say it with confidence. And that is what happened. The Mumbai one, in the first level, it was labeled as XE, but subsequently in the core INSACOG lab, when it was tested, it turned out to be either XM or XJ. Now, because interpretation of genomic sequence is not easy, and that's why several layers of tests have to be done to confirm if there is so-called variant and which may cause concern. So it turned out that the Mumbai one was not XC. Now we have found that there is another case which has been labeled as XC in the first round of testing by Gujarat. And this happened to a person who had come in contact with a British citizen. We are doing follow-up repeat testing of a different sequencing nature to see whether it is actually XE or not. Having said that, XE, even both these patients, we have complete clinical details, epidemiological details of these two individuals. Both of them had minor fever for a few days. They were put on quarantine. There was no increase of cases around them or clustering of cases. Transmission of cases also did not occur. And so what I would like to
Right.
say that this is not of something epidemiological concern. This is not something which is of clinical concern, means severity of disease. And third is that all those who have received the vaccine, and both these individuals had received the vaccine, there was no severity, no risk of hospitalization or any other severe disease indicated.
Okay. Thank you, Dr. Arora, for allaying the concern as far as this new XE variant is concerned. But can this be behind the rise in weekly COVID cases that we are seeing in Delhi, Haryana, and some other parts of the country? Where all have you started seeing a rise in COVID cases?
So there are 5 or 6 states, Haryana, Delhi, Maharashtra, Kerala, and Mizoram. These are the states where some recent increase in 30-40% at a weekly level case have increased. And these states have been asked uh, to, to ensure that if whatever is happening, a close watch is kept. We are already doing sequencing of cases in these states as before. And in some of the states, we have also started sewage sampling and sewage sequencing also. Because at this time, when the number of cases are 1,000 or so in the whole country, the number of cases go down, and but asymptomatic cases keep on occurring in the community, so that you pick up the virus in sewage, because the infected individuals keep on excreting that virus. So that is, so there is total kind of high degree of alertness on part of INSACOG network to take care of that. Now the second thing is, what could be the reason? So one of the reasons it appears is that because of recent decisions that masks may not be required, I think many of us have dropped down our guard in terms of corona appropriate behavior, not only masks, social gathering, going into the crowd, hand sanitation. That may be one of the reasons. But having said that, we are not sitting, and we are looking at the viral isolates in these to see if there is some other event happening. The important point is there is no clustering of cases, because usually if there is a variant, then there will be clustering around a particular case. There may be too many cases. That is not happening. So it looks a more wider kind of a thing, that some probably people have lowered their guards, and that may be the reason. But again, I would emphasize, genomics surveillance is very, it has been made more sensitive in last 4-6 weeks, because as the number of cases are coming down, we have started doing with sewage sampling.
So, Dr. Arora, will you then recommend the states to bring back this mask mandate, which has been dropped, which has been made optional?
So let us have the results from the genomic sequence. But generally, there are 3 points I would like to make. COVID is very much here. So there is no place for complacency. Second, that whatever we may say, I think our people have behaved in a very responsible manner, and corona appropriate behavior has been very helpful, particularly social functions have not been taking place. And the third is that vaccination is something which we need to work aggressively now, when the precaution dose has been allowed to everybody above the age of 18 years. There is an initial, looks like a slow uptake, but it looks like more because of the holiday and other things. But I'm sure as the time goes on. And the important thing is that the cost of the vaccine has been brought down at the same rate at which the government is purchasing, so that it does not pinch the people.
So you think that lower turnout was probably because it was Sunday yesterday, because just a little over 9,000 odd people had come out in the last 48 hours to get precautionary dose. Do we have enough stock for a precautionary dose to people who will be eligible in the age group of 18 to 59 simultaneously for people above the age of 60?
India has now the vaccine stock to take care of the whole of Africa, leave aside India. There are plenty of vaccines. Vaccine is not a issue at all at this time. Covishield, Covaxin, both are available, and now we have another 4 types of vaccines available, and we are in a very happy situation as far as vaccine availability is concerned.
Okay, Dr. Arora, one last question before we let you go. Now, as you have started precautionary dose for people above the age of 18 as well, is there plan to mix and match vaccines when it comes to precautionary dose or booster shots?
So there are 3 studies going on. We are waiting for the results. And as I'm sure you would agree that decisions have been science-based. And we are ready to modify the policies as new evidence appears. So if we find that mixing leads to no reactogenicity, actually safety is a major issue. And then the immunogenicity. Immunogenicity is likely to be good, but it is the safety, because some mixture vaccines may cause severe local reaction. So we are waiting for that. As soon as those results are available, we will revisit the policy and accordingly take decision.
All right, Dr. NK Arora, thank you very much for joining us live on Urban Debate on Mirror Now this evening and allaying the concerns of people as far as this new variant is concerned. Thank you for joining us.